Have you ever wondered what this thing called functional medicine is all about? Are you curious about the difference between conventional medicine versus functional medicine? Well, in this video, I'm going to go through 5 differences and I'm going to tell you which one I think is better. Hi, I'm Dr. Renee, also known as the libidoologist. I help women improve their energy, lower their stress, lose weight, and boost their libido naturally. Now, before we begin, I want to start off with a little disclaimer. We're going to be talking about the difference between conventional medicine versus functional medicine. And to be completely honest, one is not better than the other. There is a time and a place for each when it comes to your health. However, in my opinion, I honestly don't think that we necessarily need a pill for every ill, which is the basis for treatment in the conventional model. And this is not to throw your doctor under the bus. Listen, I was trained conventionally as well. And this is how I was taught to take care of patients. So I get it. Your doctor doesn't know any other way, and neither did I for over 15 years. But I have practiced both conventional medicine and functional medicine. So I can say with 100% certainty that there is a difference. And fortunately or unfortunately, my discovery of functional medicine was completely accidental. It only came after having a mystery illness that the conventional medical world couldn't fix with a pill. So I was told that I was just going to have to live with my symptoms. And I refused to take that as the final verdict. So I went out to search for answers myself to my symptoms. And on that search, I found functional medicine. Okay, so let's dive into difference number one. Conventional medicine is about making a diagnosis and treating it with a prescription medication. And again, this is no fault of your doctor, so please don't get mad at them. This is how we're trained. We're trained to take a symptom, match it with a diagnosis, and then slap a pill on top and call it a day. However, in functional medicine, we're more focused on looking at the symptoms and trying to figure out the root cause of each symptom. And when I say root cause, what I mean by that is we try to figure out the reason why. And honestly, many times multiple symptoms may come down to one root cause. This is now what I do with my clients, and it is life changing. Many times they could never have imagined what we ultimately uncover as the reason why they feel a certain way. But when we address it, their symptoms resolve. Difference number two. Conventional medicine is about treating the labs and imaging. Whereas in functional medicine, we really focus on the person. We listen to what they think might be going on. We listen to them talk about their symptoms. We take a detailed history, which may go back as far as birth. And then we utilize strategic, specialized functional lab testing if needed to help determine the underlying root cause. Many times the cause may be suspected, but the fix may not be as easy as you think, since many times we uncover things like nutrient deficiencies, food intolerances, and hormonal imbalances that do take a little time to resolve. And whereas the tests in conventional medicine are largely blood tests, those in functional medicine not only utilize blood, but we also test saliva, urine, and stool, which makes the collection methods a lot easier since they can be done in the comforts of your own home. And I actually think I just gave you a 2-for-1er here in this difference. If you're enjoying this information, be sure to hit the like button and don't forget to subscribe and consider sharing it with someone who may have been wondering if functional medicine would be a good fit for them. Okay, on to difference number 3. Conventional medicine usually focuses on one symptom or system at a time. So we take a symptom, work it up with labs and maybe some imaging, and then we come up with a diagnosis and prescribe a medication. And then we can move on to the next symptom. Many times you're bouncing between specialists because one doc specializes in one organ and a different doc specializes in a different organ. So honestly, the body is seen as a sum of the pieces. Well, in functional medicine, we try to look at all of the symptoms to figure out if they're connected. We see the body as a whole with dysfunction of one organ or one system often affecting the other systems and even the entire body. And as I said before, many times, many or multiple symptoms can lead to one root cause. So you address that root cause, you can resolve many symptoms all at once. Difference number 4. In conventional medicine, the doctor or healthcare professional is seen as the authority. And listen, I went to school for a really long time to become a doctor and an expert in my field. So I 100% get it when docs consider themselves the authority. However, many docs in the conventional world frown upon patients coming in and saying things like, "Hey, doc, I read this on the internet," or "I heard this on TikTok." And I'm the first to admit that TikTok is not always the best place to get your medical advice since there are so many so-called experts on that platform. But this really should open up a conversation to see where the patient is coming from. But oftentimes the patient is just shut down completely and they're told what is going to happen next. Whereas in functional medicine, the patient is the authority. You know best what's going on with your body. And I think it's more of a collaborative approach. The provider comes with the expertise on the subject, and the client comes with the symptoms and their take on what they think is going on. And then the provider and the client meet in the middle, figuring out what steps to take next. If you found this video helpful so far and you want to learn 5 more ways that conventional medicine is different than functional medicine, then head on over to my blog at drreneewallenstein.com. And if you want to learn more about a functional medicine approach to women's health, be sure to follow me on social media. I am at Dr. Renee Wallenstein on all platforms. Okay, so now let's finish up with difference number 5. Conventional medicine is heavily medication-based with very little responsibility put on the patient. Again, a diagnosis is made and a pill prescribed that is supposed to make the symptoms all better. And while it might make you feel better, it's just a Band-Aid. You stop the medication and many times the symptoms come rushing back. And listen, you're not at fault here. It is our society that has conditioned us to go to your doc with every little symptom to get a pill. And again, this is the pill for every ill mentality. And people wonder why they end up on 20 different prescription medications. Whereas functional medicine is heavily lifestyle based with 100% of the responsibility placed on the patient. When a root cause is determined, many providers prescribe a lifestyle change first and foremost. And this may include such things as changing up your diet, recommending maybe more sleep or more water, advising on an exercise plan, or cutting out a certain toxic exposure. The next step might be strategic supplementation to replace deficient nutrients or correct hormonal imbalances. And prescription medications are the last option in emergency situations, but often only for a short-term solution. Guess what? I have a bonus difference for you. Conventional medicine tends to be reactive versus functional medicine, where we try to be more proactive. Yes, people do go to their doctors for annual exams, but it's a rarity that you show up to that visit without some sort of complaint that requires a workup. And again, this is conditioning by our society. We're told you only go to your doc when you're sick or you have a problem. Otherwise, why bother? And in a perfect world, functional medicine takes a more preventative approach. Now, I've had many women come to me when they've not gotten answers from their doc, or when they were told that they have to live with their symptoms, or when medications no longer worked. And heck, that's how I got to functional medicine. But I do think far more people go to functional medicine providers so they don't develop a chronic medical condition, or maybe they've had a brush with a serious illness and they don't want something worse to happen to them. So they're ready to take a more proactive approach. And we love when our clients are proactive because we're here to teach you how to take care of yourself so you don't develop chronic medical conditions that will affect your quality of life down the road. We want you to be happy and healthy for as long as possible. So that's all I have for you. If you enjoyed this video, check out one of my most viewed videos here on YouTube, my top supplements for women in their 30s and why, if you want to take a deeper dive into this thing called functional medicine. And with that, we'll see you right back here next week. Bye for now.